My name is Kemal Erkan. I'm the chairman of American Surgery Center, and I have Dr. Isaias Irgau with me, our president for CHRIAS.
The idea, and there are different things that one can do, obviously, to try to curtail calorie intake. But with intermittent fasting, really what the idea is that we take a break from taking calories, whether it's liquid calories or solid calories, whether it's food, whether it's drinks. We take a break consciously, right? We say, during this period of time, I am not going to eat. I'm just going to have water or another drink that doesn't have any calories. That's the idea, right? We take a break. That means also, by definition, we are restricting the time in which we allow ourselves to have calories to eat. Okay. And this can be done in different ways, but let's talk about the concept first. There is a kind of increasing popularity to intermittent fasting done in different ways. People may say, okay, I'm going to take my 24-hour day and I'm going to divide it into a period of fasting and a window of eating. Or they could say, I'm going to take my week and then divide it into days of fasting and then days in which I eat. These are different things that people have done, right? But the concept is more important to understand. And then which one to pick, which one uses, depends on the tolerance level, on the lifestyle, and other things, right? So let's take, for instance, the simple way of doing it, like the intermittent fasting that happens every day. Okay, well, Kamal, you and I know that all of us fast during a 24-hour period when we go to bed. We sleep, right? When we are asleep, we are unconscious, right? And during that period of time, the only thing that gets in and out of our body is air, right? We breathe in oxygen, we breathe out CO2. That's what we do, right? There is no eating, there is no calories when we are asleep. So we are already fasting. And the idea is, let's expand those hours in which we are naturally fasting to our waking hours as well. And the way to do this, the simplest way to do this, Kamal, is to stop eating a few hours before one goes to bed, and then not starting to eat until a few hours after one wakes up, right? So, for instance, if we want to take an example of somebody who usually goes to bed at 10 p.m., they could decide to stop eating at 8 p.m. They say after 8 p.m., the kitchen is locked, the fridge is locked, they can have water, a lot of water, but nothing else. And then they go to bed. Well, when they're in bed, they're already naturally fasting. And then let's say that person wakes up at 6, 7 in the morning. Instead of delving in quickly into breakfast or snacking or something, what they do is they can drink coffee, they can drink tea with no sugar because we want to avoid calories, right? And then they may decide not to have anything to eat, let's say until 10 a.m. Or if they are a little bit stronger, until 12 p.m. Let's see what happens if they stop eating, they don't eat until 12 p.m. That means, Kamal, they have been fasting from 8 p.m. the night before all the way until 12 noon of the day next day, which means that's a 16-hour span. Well, 24-hour is a day, right? If you take 16 hours off for fasting, it means your eating window now is restricted to 8 hours. Mm-hmm. Now, people will talk about merits or not of this, right? And there may be people who really insist we have to eat 3 times, we have to eat 4 times, and so forth. And this debate may continue. But why do I like this idea, Carl? Because I believe one of the biggest problems we have in our society here is we eat mindlessly, right? We eat mindlessly. Yes, exactly. There is snack. Food is pervasive. There is food everywhere. You go to the bank, Kamal, and they have candies right on the counter for people to pick up.
They do.
So because it's so pervasive, if you decide to have this type of restriction in which you consciously give yourself time in which to eat or not, then you are going to be eating less. And that's what we want. That's exactly what we want. And then for most people who are busy during the day, this is actually reasonably, achievable, right? And in fact, when I ask many of my patients whether they are breakfast people, most people will tell you, you know what, I don't even eat in the morning. I wait until I wait. Well, do it properly then. Don't take any calories. And from a physiologic point of view, why is this important? I think it's important because when we don't eat, it means our insulin level stays flat. It doesn't rise. And insulin, on top of being a hormone that regulates blood sugar, is actually an important hormone that regulates whether fat cells utilize fat for energy purpose, let it go for energy purpose or not, right? So the less rising insulin we have, we're more likely to burn fat for our energy needs, which means we're likely to lose weight as well. So I do like this concept, Kemal. I do like, and I advocate it on our patients as well.